This is the first video in a series of 3 that I'm doing showing you the most common exercises we use here in the clinic to help our patients get rid of carpal tunnel syndrome. I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsborough. Let's talk about what carpal tunnel actually is. Where the forearm bones are ending, you have the carpal bones right there, right before the hand bones. And the space, as I said, is about the width of your thumb, right in there. There's that little space, that's the carpal tunnel. So the hand bones are here, the forearm bones are there, in between those are the carpal bones, and that's where the carpal tunnel is, right there. You have tendons running through that space that flex your fingers, bend them, and you have the median nerve. Something has occurred that's causing inflammation. And when you have inflammation, you have chemicals, inflammatory chemicals, and those are an irritant to a nerve, so that can cause symptoms. And you have an increase in fluid because of the inflammation. So, think about when you've hurt yourself and it swells, because there's fluid in there. When you have fluid in that small space, it starts compressing on the median nerve. And when that happens, you can get numbness and tingling just in that space. As it lasts a long time or becomes worse, the numbness and tingling, pins and needles can spread into the hand and fingers. And or you might have pain. So you might have pain that just starts there and then it starts to spread into the hand and fingers. And it's usually going to be the thumb, index finger, and the middle finger that you're going to feel those symptoms if it does move into the fingers. And in more severe cases, when it's lasted a long time and or there's more pressure on that nerve, you can actually start to experience weakness and atrophy where the muscles actually start to get smaller. That's what carpal tunnel is. What are some of the causes? Prolonged wrist position. So if you had your wrist in a position like this for a long period of time, that can be an irritant to those structures in there. Extreme wrist positions. Another common factor, somebody has a job where there's a lot of vibration, and that can irritate those structures. So in addition to these exercises, I want you not only to do the exercise, but also avoid the aggravating activities. If you had a scab and you continued to pick it, it's going to take forever to heal if it heals at all. In addition, many studies have shown that wearing a splint to keep your wrist in a more neutral position, that can be helpful. So do that. Sometimes it's just a night splint. In some cases, people have to wear the splint all day long. Now let's get on to the exercises. So this is video number 1 in the series I'm doing for teaching you how to get rid of carpal tunnel syndrome. And in this video, I'm going to show you how to do an exercise called cervical retraction and extension, because I want you to clear your neck to make sure that your symptoms in your wrist or forearm and hand are not coming from your neck. If there's a chance you have carpal tunnel syndrome, I first want you to rule out your neck, your cervical spine, as a source of your symptoms. Because I can't tell you how many times I've been treating somebody with forearm or wrist pain for a couple of weeks and they're not improving that much, and then I go and look at their neck, we start treating their neck, and then their symptoms go away. So you've got to screen the neck, clear the neck first. I'm going to give you an exercise to do. It's my favorite exercise for the neck. It doesn't work for everybody, but it does definitely work for most of the people I work with. So give this a try. I encourage you to have a chair with a straight back. You're going to put your bottom all the way back in the chair. If you have a lumbar roll, use it. If not, you can roll up some towels or use a roll of paper towels, which is even better. So here I go. This just gives me this ideal posture to put my back, torso, and neck in ideal alignment. This exercise is called cervical retraction and extension. I'll show you from multiple angles. So the first move is retraction, and I'm putting my finger here just as a reference point for you to see. You can see how I move my head and my neck backwards. So from here I retract. That's retraction. So I retract. From here I extend. I look up and back as far as I can. Up and back. Back to retraction, and then neutral. Retract, extend as far as you can, hold 1-2 seconds, back to retraction, neutral. Retract, extend, back to retraction, neutral. I'm holding the extended position for 1 or 2 seconds. I'm trying to go as far as I can, and I'm trying to go farther each time I do it. Retract, extend. extend, back to retraction, neutral. Once you're fully all the way back and there's no more restriction, you're going to add a little rotation. You're going to be turning your head no. You'll be turning your head no in the extended position. Retraction, extension, rotation. Back to retraction, neutral. Retraction, extension, rotation, retraction, neutral. I'm shaking my head no about 5 times. 1, 2, 3, 4, 5. Retraction, extension, 1, 2, 3, 4, 5. Back to retraction, neutral. From this angle, retraction, extension, rotation. Back to retraction, neutral. Retraction, extension, rotation, retraction, neutral. Retraction, extension, rotation, retraction, neutral. When I'm rotating, I'm even trying to move farther back into extension. You should be feeling a lot of strain in your neck and even in your mid-back because it's mobilizing all of those joints. I want you to do cervical retraction and extension with rotation. Do 10 reps, rest a minute, another 10 reps, rest a minute, another 10 reps. So you're going to do 3 sets of 10 to 15, going back as far as you can. Now, once you've done your 3 sets of cervical retraction and extension with rotation, then see how your symptoms were. If you'd had active symptoms at rest, are those any different? Did it change? Does it feel better? If this neck exercise did help, if your symptoms are better, maybe your strength is improved, the pain is less, maybe the pain is gone, then you're going to do cervical retraction and extension, 10 to 15 repetitions every 2 to 3 hours. And you're going to do this for several days or a couple of weeks until your symptoms are all the way gone. Once they're all the way gone, then maybe just do this once a day as a preventative measure. If it kind of helped, but not really, I'd still have you do it for a couple of days before even trying these next 3 exercises. If it did nothing at all, let's move on to exercise 2, 3, and 4 for treating and eliminating your carpal tunnel syndrome. I've just shown you how to do cervical retraction and extension in order to clear your neck before moving on in order to treat and eliminate carpal tunnel syndrome. If you like what you've seen in this video, subscribe to our YouTube channel, click on the little bell. That way you're going to be notified every time we upload a new video teaching you how to do one of these exercises, showing you how to get rid of your pain. Share the video with your friends and like the video and leave comments below. Let us know what you thought of the video. If it helped you, let us know. And if it didn't help you, let us know that as well, because then I can suggest a modification to the exercise that might make it more beneficial to you, or I can steer you to another exercise altogether that might be more appropriate for you.